All right, I will be discussing some frequently asked questions about the medical model, sensory integration training, and applied behavior analysis. I will begin with some FAQs about the medical model. One major question is whether or not parents should give their child medication for their bad behaviors. You can give medicine for hyperactivity, short attention span, aggression, sleep problems, anxiety, depression, and tics. Medicine, however, does not fix these things, it just covers them up. Medicine usually does not help for difficulty following directions, refusal, slow learning, not talking or low communication skills, and social skills. All of these things I just listed can be improved with applied behavior analysis. Another question is, what are the side effects of medications? Typical side effects for different medications can be loss of appetite, trouble sleeping, GI problems such as vomiting, nausea, and constipation, headaches, weight gain, increased appetites, and sometimes, depending on the medication, osteoporosis and heart issues can come into effect. Third question is, are these side effects worth it? It's really up to the family to decide whether or not the side effects outweigh the negative behaviors our child is engaging in. The Autism Speaks website has a great resource for this that compares benefits and risks of taking medication. With this resource, you can compare personal values, and it provides a visual that allows you to outweigh your options. Because there are so many side effects of medication, it's really important for the family to discuss the side effects and really discuss the options to make sure they're doing the right thing for their child. You can find the document that I mentioned above on the Autism Speaks website or by searching Autism Speaks medication decision in your search engine. Some frequently asked questions about sensory integration training are, for what age group is sensory integration most important? Sensory integration can really be used for all age groups. However, for infants, sensory integration training helps with self-regulation, motor development, and adaptive behavior. For school-age children, sensory integration training helps with self-care skills, progress at school, and their ability to focus to learn. For adolescents and young adults, sensory integration training helps these individuals adapt their learned skills to work environments and leisure activities and allows them to be successful in these environments. Adults are able to maintain their sensory integration training skills, but it allows them to adapt to new jobs or living situations and helps them build and maintain relationships. Another question about sensory integration training comes from the perspective of a teacher. This question is, how could I help someone with sensory processing and integration issues in my classroom? For children with sensory issues with light or touch, you can give them a visual cue in the classroom when these things are going to happen, like if the group's going to be crowded together or if the lights are going to be on or off, you could point to that visual cue, or you can provide pressure or touch when things are going on in the environment. For children who need sensory input to stay on task, teachers can provide inflated pillows they can sit on or allow for time for swinging, climbing, bouncing in between classes. Teachers can allow the child to get up and erase the board or sharpen pencils to kind of keep them moving in between their schoolwork. And you can allow for frequent breaks in the classroom. For children who need extra sensory input in their mouths, hands, or legs, you can provide straws or rubber tubes that they can chew at their desk. You can allow them to use a small soft ball such as a stress ball or a balloon filled with flour that they're able to squeeze during class, or you can provide a weighted blanket or vest that they can use at their seat. These routines are helpful in teaching students to self-regulate their behavior. However, these can be distracting in a classroom environment and do not allow for a natural learning environment. Additionally, these materials may not be used or accepted in other places. Environments such as doctor's offices, church, grocery stores, or other classrooms, they might not allow students to use them in these places, or people might not accept it as easily. If students or children rely on their sensory training, but it is not available everywhere, these skills might not be as helpful as one would hope. Now I will discuss some frequently asked questions about applied behavior analysis. One major question about ABA is whether or not it's a new fad. The answer to this question is no. Research on applied behavior analysis began in 1960 and has been the treatment of choice for children with autism spectrum disorders since 1981. Another question is ABA only effective for someone when intervention is started at an early age? Though research shows that early intervention allows for the best results, ABA has proven to help make improvements throughout the lifespan. Another question is if ABA is only practiced in home settings. Although many programs are run as in-home therapy-based programs, there are also schools, centers, clinics, etc. that offer ABA services. Therapies are not limited to their main setting. ABA is comprehensive and teaches individuals to generalize their skills in all settings and across people by practicing skills in and out of the learner's environment. Another question is how much ABA therapy is needed. This really depends on the child or client receiving the services. Programs are written based on the progress and skill acquisition of the client, and because everything is so unique to the individual, there's not a set amount of time of how long they'll need the services. This type of therapy can be changed and adapted as the learner progresses and can be implemented throughout the lifespan. A fifth question is which states provide coverage for ABA services? Through the Affordable Care Act, ABA is mandated in 29 states plus the District of Columbia. These states are Alaska, Arizona, Arkansas, California, Colorado, Connecticut, Delaware, Illinois, Indiana, Kentucky, Louisiana, Maine, Maryland, Massachusetts, Michigan, Missouri, Montana, Nevada, New Hampshire, New Jersey, New Mexico, New York, Ohio, Oregon, Texas, Vermont, Washington, West Virginia, and Wisconsin. However, if families have insurance through their employer, but that they're happy with, but that doesn't allow for ABA services, the Affordable Care Act and the Marketplace have, it's called child-only coverage for anyone under the age of 21, so parents can enroll their child in that, but still keep their insurance from work, and that way their child can have ABA services. My last question is there a cure for autism? The answer to that is no, there is no cure for autism. The medical model takes care of the medical needs of those with ASD, but only helps with the associated medical side effects of the disorder. Sensory integration training helps individuals with ASD adapt to their environments and cope with their sensory processing and integration issues. Applied behavior analysis allows for the most comprehensive approach. The behavior, modification, and communication skills taught using the principles of behavior analysis help with all behaviors associated with ASD that the medical model and sensory integration training serve to cover up. Applied behavior analysis is the most effective treatment model to improve the lives of those with autism spectrum disorders. This model has the most extensive research backing it. It allows for those on the spectrum to work towards independence by teaching appropriate communication skills, self-help skills, and appropriate social skills. Thank you for tuning into our debate.